Okay, in continuation with the last topic we were discussing, the types of dosage form. We discussed the type of dosage form in that we discussed solid dosage form, then liquid dosage form, and today we discuss the topical dosage form. Right. So in the topical dosage form, first is your pressurized dispensers or aerosol sprays. So several different types of pharmaceutical products may be packed in a pressurized dispenser. They are known as the aerosols. The surface spray produces normally droplets of 100 micrometer diameter or greater. They may be used as a surface disinfectant, wound or the burn dressing, relieve irritation of the bites. Okay, then spray and dusting powders are also available for the pressurized containers. Okay, so you can use, means you can say nowadays we are using for the disinfection purpose. You can see there is advertisement of the products like a Savlon, which is used. So that is your pressurized sprays or aerosols spray. Then coming to the rectal dosage forms. So that is suppository. So it is a small solid medicated mass, usually cone shaped, that is inserted either into the rectum, that is known as the rectal suppository, okay, and vagina, that is known as the vaginal suppositories, or we call them as pessaries also, where it melt at the body temperature, that is at 37 degrees centigrade. So these are the suppositories. As you can see, these are the cone shaped, and this is your suppository mold in which they are made. Right? Then next dosage form, rectum, that is enema. So enema is the your procedure of introducing liquid into the rectum and colon by the anus. So it is normally used for cleansing the bowel. So normally before the operations, you might have seen that they give the enema for cleansing your bowel totally. So there are types of enemas, are evacuant enema. So it is used as a bowel stimulant to treat the constipation. Example is your soft soap enema and magnesium sulfate enemas. Right? The volume of the evacuant enemas, it may reach up to the 2 liters. Right? They should be warmed before to the body temperature before the administration. So this is normally precaution given to the while using, before using. So they should be warmed to the body temperature before administration, as it is normally 1.5 to 2 liters. Right? So evacuant enema, so they are basically used for your cleansing purpose, cleansing the bowel. So second is your retention enema. So their volume does not exceed 100 ml. So no warning is needed because the volume is normal, that is 100 ml. Right? So it may exert the local effect or systemic effect. So local effect means, example is a barium enema is used as a contrast substance in a radiological imaging of the bowel. Okay, so it is used in the diagnostic purpose. Then systemic enema. So administration of substance into the bloodstream. So this may be done in the situation where it is impossible to deliver a medication by the mouth, such as your antiemetics. Right? So example is your nutrient enemas, which contains carbohydrate, vitamins and minerals. Right? So vaginal dosage form. So first, as we discussed, that pessaries. So pessaries are solid medicated preparations designed for insertion into the vagina, where they melt or dissolve. Right? So there are 3 types. That is molded pessaries. They are cone shaped and prepared in a similar way to the molded suppositories. As I showed you the mold of the suppository in the previous slides. And second is compressed pessaries, made in the variety of shapes and are prepared by the compression in a similar manner to the oral tablets. So these are your compressed pessaries, these are your molded pessaries. And vaginal capsules are also available. Okay, are similar to soft gelatin. Oral capsules differing only in size and shapes. Okay. So vaginal rings, these are donut-shaped polymeric drug delivery devices. So they are designed to provide controlled release of the drug to the vagina over the extended period of time. Okay. So several vaginal rings products are currently available, including your Femring. This is a low-dose estradiol acetate releasing ring. It is manufactured from the silicone elastomers for the relief of the hot flashes and vaginal atrophy associated with the menopause. And Novo rings, it is a low dose contraceptive vaginal ring that is releasing the progesterone and estrogens, right? So these are the vaginal rings and suppository. Then douches. So douche is a device that is a normally it is a device used to introduce a stream of water into the body for the medical or the hygienic reason. Okay. So normally douches are prepared. This example is your caminophora douche, potassium permanganate douche is that is used as an antiseptic for cleaning the your vagina. Right. So this you can see these devices are used to introduce the stream into the vagina. Then intrauterine devices. It is a birth control. Okay, you can see this is known as the T, copper T also, right? Birth control device placed in the uterus, that is also known as intrauteral devices or a coil. The IUD is a world's most widely used method of the reversible birth control. So device has to be fitted inside or removed from the uterus by a doctor. Okay, it remains in place the entire time pregnancy is not desired. So depending on this type, a single intrauterine device is normally approved for the 5 to 10 years of use. Right? So there are two broad categories of intrauterine contraceptive devices. A is inert and copper-based devices, and B is your hormonally based devices that work by releasing the progesterone. So next coming to the parenteral dosage forms. So as the name indicates, it is parenteral, means beside intestines. So these are injections, or we call them in the common language as an injection. So it's an infusion method of putting liquid into the body, usually with a hollow needle and a syringe, which is passed through the skin to a sufficient depth for the material to be forced inside the body. So it is a various types of your routes are available, as intravenous, intramuscular, right? So several methods of injection, including intravenous. It is a liquid administered directly into the bloodstream via a vein. Its advantages when a rapid onset of action is desired. Okay, so it is very advantageous when we require a rapid onset of action, or for the in the unconscious patients, right? Because it is directly going into your blood, right? Then intramuscular injection, it is the injection of substance directly into a muscle. So many vaccines are administered intramuscularly. So depending on the chemical properties of the drug, the medication may either be absorbed fairly quickly or it is more gradually. So it is also used as sustained release for the sustained release of the medicament or dosage form. So injections, fibrosis is complication that may occur if the injections are delivered with the great frequency or with the improper techniques. So it has to be given very carefully. Then subcutaneous injection, as you can see, it is normally for the diabetic patients. They take this insulin by this subcutaneous route. So subcutaneous injections are given by injecting a fluid into the subcutaneous layer of the skin directly below the dermis and epidermis. So subcutaneous injections are highly effective in administering vaccines and such medication as the insulin, as it is, right? Then inhaled dosage form or inhalers, right? So inhalers are the solution, suspensions or emulsion of a drugs in a mixture of inert propellant that is held under the pressure in an aerosol dispenser, right? So release of a dose of the medicament in from the droplet of 50 micrometer diameter or less from the container through a spring-loaded valve incorporating your metering devices. The patient then inhales the released drug through the mouthpiece. Okay, so you might have seen in the asthmatic patients they take this by this route. In sometimes the valve is actuated by the finger pressure. In other time the valve is actuated by the patient breathing in through the mouthpiece. Right? So it is commonly used to treat asthma and other respiratory problems. Then nebulizer or atomizer. So it is a device used to administer medication to the people in the form of a liquid mist, that is to the airways. It is commonly used in the treating asthma and other respiratory disease. It pumps air or oxygen through a liquid medicine to turn it into a vapor, which is then inhaled by the patient. Right? So it is as a general rules, the doctors generally prefer to prescribe inhaler for their patient because these are cheaper, it is more profitable, carry less risk of the side effect. Nebulizers for the reasons are usually that is reserved only for the seniors, your serious cases of the respiratory disease or your severe attacks. So eye drops as you know, these are the saline containing drops. Normally these are the drops used as the saline containing drops or used to administer the medication in the eye. So depending on the condition being treated, they may contain the steroid, your antihistamines or the topical anesthetics. So eye drops sometimes do not have the medication in them and only lubricating and tear replacing solutions. Probably when you use the computer too much, then you can use this type of your solution. It does not contain any medicament, right? Then coming to the ophthalmic ointment or the gels, right? So ophthalmic ointments, these are the sterile semi-solid preparation intended for application to the conjunctiva or the eyelid margins, right? So normally you see that eye drop should be sterile because we are giving to the eye and it should have the precautions if any your colored substance is seen or any solid particle is seen, okay, so then it must be discarded, right? Then otic dosage form. So eardrops is a solution, suspensions or emulsions of the drugs that are instilled into the ear with a dropper. Okay, so droppers, you can see here it is a dropper and it is instilled with the help of a dropper. Right? It is used to treat or prevent ear infection, especially infections of the outer ear and the ear canal. And next is your nasal drops and sprays. So drugs in the solution may be instilled into the nose from a dropper or from a plastic squeeze bottle. So the drug may have a local effect like your antihistamine or decongestant action. Alternatively, the drug may be absorbed through the nasal mucosa to exert a systemic effect. The use of oily nasal drops should be avoided because of the possible damage to the cilia of the nasal mucosa. And one more reason is that it may cause the lipoidal pneumonia, right? If it is if your oil goes into the lungs for a longer period of time, then it may cause lipoidal pneumonia, right? Then coming to the intermediate products which are used in the compounding. So extracts, so these are concentrated preparations containing the active principles of the vegetable or animal drugs which have been extracted with the suitable solvent and it is concentrated to form the liquid, soft or the dry extract. Right? So these are used for your intermediate means when you need the extract like your gentian extract. So various types of extracts are available. So glycerin, so these are the solution of the medicament in glycerol with or without the addition of the water. So these are known as the glycerins. Infusions, these are your dilute solutions containing the readily soluble constituent of crude drug and they are prepared by diluting 1 part of concentrated infusion with 10 parts of the water So concentrated infusions are prepared by the cold extraction of the crude drug with the 25% ethanol, right? So these are known as the infusions. Then oxymels, these are preparation in which the vehicle is a mixture of acetic acid and honey, right? So those are known as the oxymels. Then spirits, they are the alcohol or the aqueous alcoholic solution of the volatile substance used as a flavoring agent, right? So tinctures, these are alcoholic preparation containing the active principles of vegetable drugs. They are relatively weak compared to the extract, right? But they contains normally 70 to 80% of alcohol. Then aromatic waters. So these are the aqueous solution usually saturated of the volatile oil or the other volatile substance. They are used as a flavoring agents like your rose water and various types of aromatic waters are available. So students, these were the means depending on their type of route you use. So this we discuss the type of dosage form according to the route of administration. So from the next class we will discuss the type of dosage form according to the forms like solid, semi-solid and liquid. Thank you.